I want to talk about desperate women. I know something about this subject because I became pregnant at the age of 19. I was living at home and desperate to undo what had been a terrible mistake. I know something about this subject because that desperation drove me to make a desperate decision, and I had an illegal abortion, one that was performed without anesthesia in a rural farmhouse by a man whose face I never saw. I know something about this because whenever I have shared my story, countless women have approached me to tell me about their own desperate decisions. When a desperate woman wants to end an unwanted pregnancy, should she have to search for a provider? Should she be forced to travel vast distances to seek medical care? Should she have to endure deceptive counseling? Should she be delayed by a dangerously long waiting period? Should she have to face unnecessary or unwanted ultrasound procedures? Should she be harassed by anti-choice demonstrators outside the door to her clinic? And shouldn't her procedure be affordable, and shouldn't it be covered by insurance? When abortion care is difficult to obtain or when it is illegal, desperate women take desperate steps. At the time of my own criminal illegal abortion procedure, 7 years before Roe, women were dying from botched abortions. Some died from infections. Some bled to death. Others were left infertile. Illegal abortion endangers women's health. Desperate women are driven to desperate measures. Restricted access does not eliminate abortion. Restricted access forces women to seek control over their reproductive lives in any way possible. We know where that road leads, and we won't go back. In a recent survey from the Texas Policy Evaluation Project, 7% of women who were seeking abortion care reported trying to take something to end their pregnancy. 7%. Is this what we want? Do we want the coat hanger to once again become the symbol of our movement? Do we want our daughters to be shamed, stigmatized, or silent after we fought so hard for something different? This is not a future reality that we have to accept. We have a choice. You watch the video. We have a new generation of activists and leaders. Yes. And I can tell you that NARAL Pro-Choice America has a plan. As you heard from Elise, we're going to take the fight to the opposition and not allow them to hide anymore. We're going to push forward proactive policies that put a comprehensive women's equality agenda front and center. And we're going to elevate those who champion our cause and hold those who stand against women accountable at the ballot box. This is the team to do it. When a court decision forced more than a dozen clinics to close overnight in Texas, this team, along with others in this room, scrambled to do an online telethon to support women whose appointments had been abruptly canceled in finding an alternative. I was there for the telethon, and I can tell you firsthand that room was full of positive energy, and we raised tens of thousands of dollars in just a few hours. It is our job to give this team the tools they need. If you're moved by what you heard tonight, if you're excited, encouraged about our work, if you appreciate just how urgent this is, then I ask you to help us by making a gift. The right time to give is now. We don't have time to wait. We have to be passionate, bold, and fearless. We need to expand our reach. We need additional resources to do that. I want to leave you with one thought. 11 years ago, at the 30th anniversary of the Roe v. Wade decision, then Senator Howard Metzenbaum spoke at NARAL's annual dinner. His words were fighting words. Speaking about Roe, he said, "If this law is repealed, it will be the first time in American history when a right was taken away." We need you to help us not only protect that right, but expand it and make choice real for all women. Thank you.